Thank you for watching this Fringe Academy recording. You can view all videos and resources from past Fringe Academies on the Fringe Academy resources page of our website. You can also book free tickets for any upcoming Fringe Academies by going to the What's On section. Enjoy!
Okay, over to you, Becky. Thank you.
Brilliant. Thanks a lot, Amy. That's fantastic. Hi, everybody. As Amy said, my name is Becky Stevens and I'm from Hybrid Consultancy. So a little bit about me. I've over 15 years health and safety experience. I've been health and safety consultant for hundreds of events for hundreds of thousands of people, including Brighton Pride, the 2012 Torch Relay, the Rugby World Cup, so many events over so many years. Obviously, things have changed a little bit over the past year, but we've been focusing a lot on COVID-19 risk assessments and safety. I sit on the National Outdoor Events Association Council. It's a collaboration of outdoor events providers and suppliers, and as part of that I sit on the HSE board and the council of JACE, which is the Joint Entertainment Consultancy sector, and that's been incredibly helpful for looking and developing our guidance for COVID-19 safety across events and filming. I'm a technical member of IOSH and a fire safety risk assessor. Over the past year, obviously I haven't been doing that many events, but I have been doing an awful lot of COVID-19 risk assessments and training for, amongst other people, BOAT, who I'm sure you know if you're based in Brighton, Brighton Fringe, Brighton Hove City Council, Backyard Cinema, Lunar Cinema, Main Stage Festivals, and many, many more. In addition to the event side of things, we've also been doing risk assessments for small businesses and across the board to helping them to reopen safely. So Hybrid Consultancy is a small team of us. We're cross-sector health and safety experts who deliver risk assessments and support businesses of all sizes, enabling them to reopen safely and confidently. We, in line with government's latest guidance, we help businesses to become COVID-19 secure, and we make sure that everyone is compliant and is able to open and operate safely. The law requires all employers and businesses to assess the risk of returning to work while the coronavirus outbreak is ongoing and to put steps in place to manage that risk. It is a requirement for any company or venue to carry out a COVID-19 risk assessment at current. And just to be assured, that is what we're doing primarily, or that's what our work is about. So going through all the things that will hopefully help you to write your risk assessments. We're going to look a little bit at the roadmap, which is everyone's favourite topic. We'll look at which step we're in, where we're moving to. Then we'll talk about risk assessments and why we need risk assessments. Then we'll look at COVID-19 transmission and infection, COVID-19 mitigation measures, and we'll think about how, when you're writing your risk assessment, the things that we recommend that you include. So at each step, we'll have a little opportunity for some questions, or equally, if you think of things later, we can pick them up at the end. So the roadmap, I'm sure it's on everyone's top topic of conversation. Which step are we in? We're currently in step 2. At the moment, how it applies to the Fringe and to events is that event pilots are taking place across the UK. We're actually working, one of our clients is an event pilot, which has been taking place and working with the DCMS to make sure we can look at how we can reopen safely and look at all the different measures that events may have to put in place. But currently, no events can take place. Of course, this is changing when we move into the next step. As I'm sure you're aware, and I just wanted to cover it in case you weren't, what are the conditions for changes to each step? The decision is based on 4 tests. The vaccine deployment programme continues successfully. Evidence shows that vaccines are sufficiently effective in reducing hospitalisations and deaths in those vaccinated. Infection rates do not risk a surge in hospitalisations, which would put unsustainable pressure on the NHS. And the assessment of the risk is not fundamentally changed by new variants of concern. I'm sure you've all heard today that we are going to move into step 3 because we have passed the 4 tests. And amazingly, we had a day yesterday, we had no deaths from COVID, and for the first time in a very, very long time, which I'm sure you all agree is a great success of the vaccination programme. So Step 3 from the 17th of May and how it applies to Brighton Fringe. Some events can happen. Outdoor entertainment can happen, and that includes performance. So up until the 17th of May, you can't bus, you cannot perform outside at all. So it's really exciting that we now can have outdoor entertainment and performance. And also we can start to have some events which will be taking place inside, and that's inside venues as well, as long as we are making sure that they are COVID safe. So for instance, some large events can happen that have fixed capacity limits, but equally we can make sure that we have certain other entertainment can take place within venues as long as we're abiding by the guidance. Right, we're going to move on to risk assessments. So why do we need a risk assessment? I mean, most people fall asleep at this bit. I have to say, I quite like risk assessments. I must do. It's been my job for 15 years. And I find them incredibly useful. But
is that thingy from maternal who's aging?
The purpose of a risk assessment is to identify the hazards and risks associated with an activity and to put measures in place to mitigate the level of risk. I'm going to come back to discuss about what a hazard and a risk are. By having written risk assessments, the findings and the actions can be shared with all relevant stakeholders, such as employees, volunteers, and anyone who may ask to see it, such as the council or insurers. Very often I hear, and I find it slightly bizarre, I have to say, that under our health and safety legislation, you don't have to write your risk assessment down if you have less than 5 employees. But actually, if you write them down, then you can share those findings. You can then review those findings later on, because your hazards and risks will change throughout your work and your processes. As an employer, you're required by law to protect your employees and others from harm. And an employer means, and your employees, that also counts as volunteers. That counts as anybody that's working with you or for you. And you don't have to pay them for them to be classified as your employee. And under the Management of Health and Safety at Work Regulations 1999, the minimum you must do is to identify what could cause an injury or illness in your business, which is a hazard, decide how likely it is that someone could be harmed and how serious, which is the risk, and take action to eliminate the hazard, or if this isn't possible, control the risk. Assessing risk is just one part of the overall process used to control risks in your workplace. It is a legal requirement to have a COVID-19 risk assessment. I'm going to just keep reiterating that throughout this. And you also have employers have a duty of care under the Health and Safety at Work Act 1974 to assess the risks and protect your employees. So it doubles up. So you're covering it under the Health and Safety at Work Act and under the Management of Health and Safety at Work Regulations. And what is really important is that hopefully it won't ever happen, but and will never happen to you. But obviously, by having your own COVID-19 risk assessment and making sure you have shown the measures that you're putting in place, and you're taking reasonable care for the health and safety of people who are working with you, then if anyone were to get ill or anything were to happen to anybody, you can show that you have fulfilled your duty and requirements under the Health and Safety at Work Act. So, making decisions. What is a risk? The risk is the chance or probability that someone may be harmed by the hazard. What is a hazard? A hazard is the thing that may cause injury or death. For instance, a hurricane is a hazard, driving a car, using a ladder, they're all hazards. Humans make decisions regarding risk throughout every single day. You're carrying out risk assessments every single moment of the day without even realising it. When you cross the road, when you put a pan of water on to boil, when you drive a car, every single action you take, you are subconsciously carrying out an internal risk assessment. That's what I want to get across, is that actually you've got these skills within you. You're making these decisions all the time. So actually don't be afraid to write your risk assessment down, because you are consciously and subconsciously doing this without knowing. So you're making sure, so for instance, when you've been thinking about COVID-19 and how you operate recently, when you go to a shop, when you wear a face mask, when you decide to stay in during lockdown, that you are making internal risk assessments at all times. We use intuitive decision making and analytical decision making when making decisions. But humans are irrational. We aren't walking risk assessments, despite what I've just said that we do internally make little risk assessments. We don't always have all the facts to hand. For instance, many humans are scared of flying, but it is statistically much more dangerous to drive a car. And a fact that I found recently was that after 9/11, people stopped flying in the USA because they were worried about flying and terrorist attacks. But that an estimated 2,302 additional people were killed that in a year because they drove instead of flying. That was according to a 2006 survey by Cornell University. Humans make errors. Humans are arrogant. We tend to think that bad things will happen to other people. The house fire, the heart attack, 90% of drivers think that they are a better driver than other drivers. So we make errors inadvertently when we are tired or because we don't know the correct information or rules. We also make errors deliberately because we think we can bend or break the rules. And I'm sure you've all know some people within your work settings or have previously that have said, it's all right, we'll just cut this corner, it's fine, we'll just get the job done quicker. So for instance, here are some examples. Workers think rules don't apply to them, being under time pressure, not having the right equipment, a lack of understanding why the rule is in place, perception that the rules are too strict or unnecessary, wanting to take the easy option, or peer pressure. One of the great things about having a risk assessment and when you're carrying it out is that you can think about all the different ways in which errors can arise, and you can make sure you put systems in place to reduce those occurring and make sure that those errors are detected before harm arises. The other good thing about having the risk assessment is, again, you share those findings and you can share it with your colleagues and volunteers and other teams. You say, this is the finding we've had of this risk assessment. We have determined that the safest thing for us to do is that everyone watching the show has to wear a face mask. And everyone who checks the tickets has to wear a face mask. And these are the reasons why. So that then when people come in, you've got those answers and you've got those reasons why. And it's so much simpler if everyone within your team is aware of why you're carrying out these actions. So just to be clear, when carrying out a COVID-19 risk assessment, harm means ill health. And COVID-19 is a hazard. When we do risk assessments, we look at the hierarchy of risk. So ideally, we'd eliminate the risk entirely. Elimination is the best form of control. Can we eliminate the virus? Unfortunately not, but through vaccination, we can reduce that. So there's little that can be done by us as individuals or small organisations such as ourselves. We're slightly reliant on government response, but thankfully in the UK, we're in a good position there. Substitute. If we can't eliminate the risk, can we put a safer substitute in? Social distancing and staying at home are not forms of elimination, they're an administrative control. We cannot replace the virus with something less harmful, sadly. So, engineering. Can we design something that makes it safer? Engineering controls, such as like putting a physical barrier between the person and the hazard. For instance, like when you go into shops and you've got the plastic screens up. It interrupts the flow of air from one person to another and provides protection. This is a good engineering example. Ventilation is also a key engineering control, and we'll come on to the details of ventilation later on because it's absolutely key for us in helping reduce the transmission of the virus. Administrative is often cost effective and provides the best options for most people. Your risk assessment must consider how you'll keep the workplace and equipment clean, adjust your working practices and ensure people are safe. Are you sharing equipment? If so, it could be cleaned between users if they aren't in your bubble, for instance. The last resort in the hierarchy of risk control is personal protective equipment. It is often considered the weakest control because it relies on people using it correctly. It introduces many possibilities for error, being the right specification, its cleanliness, its storage, its replacement and availability. There's been much discussion about the provision of PPE in the media, but this is focused on the medical care environment, not in the normal workplace. Homemade face masks and type 2 masks, for instance, are not classified as PPE as they're not close fitting, but any mask does help reduce the risk of transmission. We often use the term reasonably practicable in risk assessments, which means the measures should be reasonable and the cost should be proportionate. do not expect you, if you've got one small show taking place in a small venue, you're not going to be able to install fancy ventilation systems. You're not going to be able to put up screens. So think about those measures that you can put in place that will make you, your team, and your guests and attendees safe. Your risk assessment should include a clear title and the scope of the assessment, who it is written by, the date of creation, and a review date. Also, we look at the hazard. Who could be harmed and how? What's the likelihood of it happening? What are the controls required to help this? How will the controls be checked? Confirm that all is in place or if further action is needed. The risk assessment must recognise the virus as a hazard, and it is a high risk. People do die from COVID, and therefore it is a serious risk, and that is why we need to put measures in place. It should reflect that the virus is spread in minute water droplets that are expelled from the body through sneezing, coughing, talking, and breathing. The virus can be transferred to the hands and from there to surfaces. It can survive on surfaces for a period after transfer, depending on such things as the surface type, its moisture content, and temperature. The risk assessment should conclude that if it is passed from one person to another, while many survive infection, some may die from the disease, and it should be regarded as a high hazard. Right, now for a quick poll, just to see if you've all been paying attention and not fallen asleep at the very exciting bits of risk assessment. So where does PPE sit in the hierarchy of risk? Amy, can you do the first poll, please? Okay, that's great. So it sits at the bottom. It's your last resort, PPE, because of the risk of there being of it not being used correctly. So well done to you. That one. Right, COVID-19 transmission and infection. Apologies again for those of you. I know it's not all we've heard about for the past year, but I think it's really important to reiterate the bits. And we've been keeping up to date with the absolute latest information and scientific research from across the world. So just want to make sure that we're sharing it with you. COVID-19 is transmitted via droplets from an infectious person's mouth and nose when breathing, talking, coughing, singing, etc. It is transmitted into another person's mouth, nose, or eyes. Droplets of the virus surviving on surfaces contaminating the hands of others who touch their face, nose, and mouth, etc. One of the most dangerous aspects of COVID-19 is how long it can take to show symptoms after becoming infectious. But remember, not everyone shows symptoms. Here's an interesting picture which can show you how far the aerosol droplets can move. So as you can see, there are respiratory droplets that are less than 100 micrometers in diameter that can remain suspended in the air for 4 hours. And they're the aerosols. And then you've got your droplets, which are the particles that are larger than 300 micrometers and due to air currents fall to the ground in seconds. So you've got 1,200 aerosols are released for each droplet. And we have it, and the COVID-19 comes out in the aerosols. And you can see it's the closer you are, obviously, the more intense it is. All right, now hopefully this video will work for us. This video shows how if you were in an enclosed room with no ventilation, how quickly the aerosols can build up. And as you can see, imagine if we were in a small venue in Brighton that didn't have any. So if we're in a small venue in Brighton that didn't have any windows or any ventilation in, how quickly those aerosols will build up. And that's there are some good online calculators as well, which can show how much it will develop over time, depending how many people you have in the room and how many ventilation and such like. Just try and see. So transmission and infection. Your incubation period will range from 2 to 14 days after the person has been infected. It's typically on about the 5th day that you start to see signs. The infectious period starts 2 days before signs and symptoms are shown. The person will be most infectious on day 1 of showing signs and symptoms. The contagion will decrease over time until they're no longer infectious. Illness will either be mild, which is up to 10 days, or severe, which is 2 or more weeks. The chart below shows the timeline if the person's incubation period started 5 days after becoming infected. So, as we know with COVID, one of the worst things is that we are infectious before we know it, and therefore the chance and risk of transmission is high, so which is why we all have to act as if we're all infected to reduce the spread of transmission. Testing and contact tracing. So I thought we discussed about the difference between a lateral flow test and a PCR test, as actually that's very important, and I think that some people do get confused between the two. Those of you who have school-age children have probably, in secondary school, been seen them carry out lateral flow tests. These are tests that you do at home. The rapid lateral flow tests are for people who do not have symptoms of COVID-19, and you can see the result on a device similar to a pregnancy test, usually in 30 minutes. They're not as accurate as a PCR test. If you do test positive on a lateral flow test, you should get a PCR test to confirm your result. Anyone now can order lateral flow tests from the government. It takes about 5 to 7 days to arrive. You get a pack of 7. You can administer it yourself at home. There's an easy guide. You have to stick the stick up your nose and in your throat and put it in the little holding thing with some liquids, and then you get your test result within about 30 minutes. We recommend that all staff, performers and volunteers carry out a lateral flow test every 3 to 4 days whilst working on Brighton Fringe. And we would strongly recommend that you put that into your risk assessment and that you help your teams have access to lateral flow tests, so that will keep everyone within your team as safe as possible. Just to be clear, it doesn't mean that it doesn't mean that you won't have COVID. It just means you're less likely to, and you are safer. So other measures should still be implemented, such as that we'll go on to later. A PCR test is carried out at a test site. You can book a location and a slot using the NHS website. Test results take a number of days to be returned. You must self-isolate in between taking the test and getting a result. If positive, you must remain self-isolated and will be contacted by NHS Test and Trace with further instructions. A negative PCR test overrides a positive lateral flow test. It is vitally important to get tested if showing symptoms, instructed to do so by local authorities or a doctor, or working in high-risk locations such as health and social care. So, next poll. Does a negative PCR test override a positive lateral flow test? I'll get the poll up. There we go. Launch poll. There we go. Oh, I think Amy and I did it together. Sorry, Amy. Yes, absolutely. A negative PCR test does override a positive lateral flow test. So for instance, if you test positive on a lateral flow test, and then you've isolated and you've gone to a test centre to have a PCR test, and that comes back negative, then that overrides the lateral flow test, and therefore then you don't have to keep isolating. Does anyone have any questions now about the tests or anything, or I can carry on. If anyone's got a question, they maybe pop it in the chat, or I can carry on and we can pick it up later. COVID-19 mitigation measures. So these are the things that we, again, think about these headings for your risk assessments when you're writing them. These are the key things that every time you're thinking of something that's occurring within your event or venue, These are the things you want to be considering each time. Social distancing, as we know, so distance is the safest thing, because as we've seen aerosols, how the aerosols travel, and the closer you are, the higher risk you are of getting more aerosols, infected aerosols. A 2-metre distance should be kept between people who are from outside the same household or support bubble. If it is not possible to keep a 2-metre distance, then mitigating measures such as face coverings or perspex screens should be used to reduce the risk of transmission. This is still applicable in step 3. So this is still applicable on the 17th, from the 17th of May, and it will be reviewed in step 4. So when you're planning the layout of your venue or show, you should think about where the front row of your audience is in relation to the front of the stage or the performance space. How will people interact with you and your team when they come to the venue? For instance, people checking tickets, or people showing people to seats, for instance. Going back to your hierarchy of risk, think about the other measures that you can put in place if you cannot maintain a 2-metre space. So your 2-metre space is your ideal, and then after that, you put your other measures in. Ventilation. So we now know that COVID-19 does not spread as easily outdoors or in locations with good airflow and ventilation. Your COVID-19 risk assessment will provide recommendations that are site-specific, but there are 4 general ways to increase ventilation. Make sure windows and doors are left open wherever possible, except those that are designated fire doors. Take regular breaks with access to fresh air. If using air conditioning and extraction units, check that they remove air from the premises, not those that recirculate the air around. If you are a performer and you're going into a venue, ask to see the venue's risk assessment and work with them to ensure that all rooms and spaces are ventilated as much as possible. To give you some examples of why ventilation is so important, a poorly ventilated room where no one is wearing masks and people are sitting, talking, breathing for an hour, the chance of infection is over 100 times higher than in a well-ventilated room where people aren't wearing masks. That's 100 times if you haven't got the ventilation, with, and that's with people not wearing masks. So, but if the room is poorly ventilated, you should wear masks, because that halves the risk of infection. So again, think of these things. Think about the venue that you're in. Think about the space that you're in. If you're in a, if you are going into a room above a pub, for instance, and you're performing in there, make sure you can open all the windows and doors well in advance of everyone arriving, and think about all those stuff. So, keep that air flowing, and then obviously think about what you can shut, and obviously what you need to, what you may need to shut, and what you can keep open. Team working and bubbles. I love a team bubble. It's my favourite thing now. Having done lots of COVID-19 safety on film shoots, we are all about bubbles at the moment and making sure that people stay in their bubbles. Quite difficult, I can tell you. So where possible, create team bubbles to reduce the spread of COVID-19 across your whole workforce. So teams should avoid contact within 2 meters of anyone not in their bubble. Effectively, treat anyone in your bubble as if they're from the same household, but obviously still keep those safety measures in place and make sure that you're not up. We shouldn't start hugging people that are in our work bubbles yet. Where possible, teams should avoid sharing equipment, work areas, transport and break areas with anyone outside their bubble. Although the rule of 6 does not apply to the workplace settings, employers should try to limit team bubbles to a maximum of 6 people wherever possible. You need to protect your bubbles. So think about your sound technicians should be, and your back of house can be treated as separate bubbles from your front of house. Your sound technician should be masked when near the artists, for instance. You minimise your risk of transmission across your workforces. And that means then, if you're a venue, then, you're not having to, look for a whole new set of staff because suddenly everyone's got COVID, because everyone's been mixing together and having breaks together and working in very close proximity. Where possible, this is about your kind of team resilience. If you are performing and you're going into a venue, treat that venue as if they are a separate bubble, and don't get too close to them, and make sure you're wearing face masks and stuff when you're interacting with them. Touch points and equipment. So whilst we know that it is an airborne virus, and we also know that There hasn't really been much, there's not been any diagnosis of people who did catch it from the phyome, which is the contact droplets. It is still, we are able to pick it up and we are still able to transmit it. So by reducing the number of touch points in the workplace, you can limit the surfaces in which COVID-19 can be spread and the volume of cleaning to be undertaken. We talk a lot about the theatre of cleaning now, and it really is now. It's going to be about public perception. So we can talk a bit more about that. But, you know, we need to clean because it does help reduce the risk of transmission, but also because the public expect us to be cleaning now. So think about things that you can do to reduce touch points, non-fire doors being left open, furniture that's not in use or surplus to requirements due to social distancing being removed and stored elsewhere, leaflets, magazines, newspapers and shared entertainment from communal areas being removed, meals and refreshments served pre-packed or get a dedicated member of staff. That's obviously if you're maybe thinking about, you know, all sharing food or what have you, getting a delivery at the end of the day, whatever, make sure that you're keeping, you know, you're not sharing food with each other. Any shared equipment should be cleaned after each use. For example, tills, tools, telephones, microphones, ticket scanners, any instruments, etc. Microphones are really important as well. If you think that you're probably generating quite a lot of spit into the head of the microphone, so making sure that clean microphones are used for every single person. And keep it clean. Have a thorough cleaning schedule in place. Tasks should be allocated and checked to make sure they've been completed. Wipe down high touch points between shows. Have wipes for pens or any equipment which might be shared. So if you are, for instance, signing people in, think about having a bit of some cleaning wipes on hand so that you can, you know, clean the pen for people, or have hand sanitizer, they can wipe their hands afterwards. Surfaces should be cleaned regularly and before and after use, including all touch points such as door handles, stair rails, buttons, controls. Bins should be emptied daily or when full, and bags should be tied and disposed of. Personal hygiene is also important. Clean clothes and regular washing help make a better work environment for everyone. Wash your hands properly and regularly, and use hand sanitizer when you can't do that. To reduce the transmission of viruses and illnesses from air particles, bins should ideally have closed lids. If, you know, for instance, if someone has sneezed into a tissue, there's no point just sitting kind of on the side, open to the air. So if it's not possible, then all those containing food waste, tissues or PPE such as face covering should be prioritised. Using closed lids also reduces odours and the likelihood of attracting pests and insects. And again, think about it. If you are seen to be cleaning your venue, and you are cleaning your venue, you are going to increase public confidence and safety. So people are more likely to return and more likely to come back because because actually it's about, not everyone is feeling comfortable about going back out into the world. Not everyone is feeling comfortable about coming back, and you know, everyone wants to experience culture. Everyone is desperate to see live performances again, but people are nervous, understandably. And you know, if we want people to come out there, we need to make them feel confident and happy about the measures that we're putting in place, and that we are prioritising their safety. Cleaning. Always use the right cleaning products for the task and check the manufacturer's label. Don't use dirty cloths or mops, as these just spread the dirt around. Use clean hot water and wear the right PPE for the job, like rubber gloves. Do please always read the labels on your cleaning products, and where possible, make sure that you are looking for, you know, antibacterial cleaning products as well. So, or things with a high alcohol content. Face coverings. So as COVID-19 transmits via air droplets, face coverings have become a major part of the world's response to the pandemic, especially in places where 2-metre distancing cannot be achieved. Face coverings do not have to be clinical or surgical grade mask. Perspex face shields, homemade masks and snoods are all acceptable as long as the mouth and nose is covered. It is recommended that coverings have at least a minimum of 3 layers of fabric. Please note that face coverings are not classified as PPE. Excuse me. For the face covering to be effective, it is important that it is secured tight to the face, covering the mouth and nose. You should avoid touching the face, covering and covering and remove it by handling the loop or tie rather than the front. You see it all too often. Everyone keeps pulling at their mask, pulling it down. It's just getting dirty. Who knows what you've touched on your hands, what have you. Make sure that this face covering is to protect you as well as other people. So make sure that you're using it properly. Always wash or sanitize hands before and after touching the face covering, and dispose of properly or wash regularly. In England, face coverings are legally required in most public places of indoor settings and on public transport, including shops, hospitality, attractions, hotel and leisure. There are a number of scenarios and locations that are exempt, for example, when sat at a table in a restaurant or to prove identification. Now, I'm going to be very, very clear, and for yourselves, so if any of you are working or going to be performing or operating within any hospitality settings, when people are indoors in a pub or restaurant, a face mask does not need to be worn at the table, but it is a legal requirement that you wear a face mask when moving about, so entering the venue or going to the toilet or leaving the venue. Currently, all patrons must wear face masks when in the premises unless eating or drinking. So think about using signage at the entrances and on any pre-event literature, website, tickets, etc., so people are aware. You may have seen these signs up. It's really important and quite handy to just remember this, catch it. Germs spread easily, carry tissues and use them to catch or cough or sneeze. Bin it. Germs can live on for several hours on tissues. Dispose of your tissues as soon as possible. Kill it. Hands can transfer germs to every surface you touch. Clean your hands as soon as you can. Work breaks. It's really important for personal well-being to have breaks from work in the working environment. But then it's all too often for people to forget. They come out of that working environment and then they're suddenly hanging out together, or they're having a cup of tea and they're close and they're chatting. And, we've got to make sure that we're still maintaining those bubbles and we're still making sure that we have that safety. So when on a break, remember to maintain social distancing of 2 metre or 1 metre plus with mitigating measures. That means if you're less than 2 metres, really should be wearing a face mask, definitely should be outside. You're making sure that you've got those safety measures in place. Clean the break area and all touch surfaces regularly. Access fresh air in the outside as much as possible. And put on a clean face mask after your break, particularly if you've been eating, drinking or smoking. So when we're writing your risk assessment, we're going to look at a few key things that you might want to consider. Capacities. So how many people usually fit in your venue? Because you can't have that many people at the moment. So if you accounted for social distancing, how many people would fit? For some venues, it's really, really minuscule. But actually, what measures can you put in place to have a safe capacity? I mean, very impossible for any real venue to operate with 2 metre distance. Let's think about the measures that you can implement that mean you could have a 1 metre plus distance in place, and therefore then you can have more people coming into your venue or attending your show. Think about the layout of the venue and the performance space. Is your audience seated or standing? If it's seated, you can define the layout easily, e.g. pairs of seats separated by 1 metre aisle. Seated is safer as all the audience are facing in the same direction. Think about the space you need to perform. How much space can you safely create in front of the performance area to protect yourself and the audience? Airborne particles travel further when we are shouting, laughing and coughing. Think about the people in the front row. If you don't have a lot of space, I really strongly suggest that you make sure that you are recommending that every person sitting in your audience is wearing a face mask. One-way flows. Can you implement a one-way flow through the premises so people go in one door and out another to save people passing in the door? Preferably stagger performances to give you time to ventilate and clean between shows. Ventilation. I'm going to keep going on about it. It really is a lifesaver. So, open windows and doors when setting up to increase airflow. If you think back to the beginning of this presentation, ventilation is critical to reduce the transmission of the virus indoors. So keeping windows and doors open as much as possible unless they are fire doors. Now, it's really, really important that we don't prop open fire doors. They are there also to save lives and they are there to prevent fire spreading. So as much as it's really important that we increase ventilation, we also don't want to forget that we can have a risk of fire within a venue. So if you open doors and windows in intervals if possible, or in between shows, because the longer you're in a room with other people, the greater the risk of transmission. So if you do have a break, if you have an interval or a short break, let's throw open the doors and windows as much as possible. Can the guests access fresh air during shows? Can you write that in? Can you make sure that your attendees can pop out if they need to, if they feel that they need to get some fresh air, if it's getting, if it's getting a bit too hot, or that, can you open the windows? Very difficult. I know if you're performing in a venue which is next to a busy street or area, but let's think about that. Visit the place that you're performing, or think about your venue and how you can make that work and make that viable. Is it better that you use you sort of turn up the PA system a bit, but you have the windows open? Think about those things. Is there air conditioning in the building? Check that it removes the air rather than circulates it. Also think about special effects like haze and what impact they will have on ventilation. Contact tracing. So it is currently a legal requirement to provide name and contact number when visiting hospitality premises for on-site consumption only, or use the NHS Test and Trace phone app to check in. This applies to every single person age 16 and over, not just the lead booker. So it's really key that ideally when you're selling tickets, you're selling them to the individuals, but if you have a lead booker, then it's still, every single person does need to check in when they come to your show. You can generate a QR code for your performance or business via this link, and we've put this on. We'll be sending some handouts later with key links in. If people cannot use the QR app, then you must take their name and phone number. Data must be kept securely by your business for 21 days and not used for any other reason or given to a third party. So you can't then, if you collect everyone's numbers, you can't then call them up and say, oh, by the way, I'm doing another show in Edinburgh, please pop down. You can be contacted by NHS Test and Trace if someone tests positive, who visited the business premises on the same day or gave your details as a close contact. If contacted or alerted by the app, you legally must self-isolate as instructed by NHS Test and Trace. Think about carrying out health declarations on your staff and team coming into the workplace. So these are things, you often see this now, obviously, wherever you go. First, when I went to the hairdressers, they ask you to just confirm in advance on the day that are you suffering from any sign or symptoms of COVID-19? What is your current temperature? Have you returned from any country listed by UK government that isn't on the travel corridor? Have you been contacted by NHS Test and Trace and instructed to self-isolate in the last 14 days? Just get this into your head, and into your team's heads to think about if they're saying yes to any of those things, don't come to work, stay at home and isolate. Think about if you need to carry out health checks on attendees, maybe having a sign up at the entrance is sufficient. Equally, perhaps you should, make sure in advance when you're sending out any pre-event information or any ticket information, just make sure, let's keep reiterating that, please don't come if you have any COVID-19 symptoms, or say yes to any of the other questions. Signage. So signs are incredibly helpful for communicating with everybody. And these are only examples, but your risk assessment will highlight others. But signs that you may need are entry, the maximum capacity of the room, health declaration, an NHS QR code check-in, please wear face masks whilst in our premises watching the show, please wait here to be called forward, contactless payment preferred, queue markers, maintain social distancing, please use hand sanitizer, catch it, kill it, bin it, washing hand instructions in the toilets, follow one-way systems and exit. It really helps if you have signs up and people can see them in advance. Years and years of doing events with hundreds of thousands of people, the more you can tell them in advance, the more information you can give them, the less conflict you have on the door of people saying, well, I didn't realise I had to wear a face mask. Well, I didn't want to check in, etc., etc. And that poor person who's managing that entrance and, desperately there's a queue behind and it's building up, has got something, written down that can back up what they're saying. Monitoring post-event. So you must, as I said before, you must keep the data for 21 days post your event in case you're contacted by NHS Test and Trace. This includes attendees, staff, volunteers and contractors. Ask for a report from the management venue team about what did and didn't work, in particular with regard to queue lines. Equally, if you see something not working during your event, work with the venue and team and report it and implement changes as quickly as possible. For instance, if the toilet queues aren't being monitored, maybe flag that up, and then in your next show, have someone there standing there to make sure that everyone's not bunching up around the toilets. Or if the hand sanitizers run out, don't assume that everyone's going, if you notice it, report it in. It makes everything safer for everybody. Request that staff and artists that you've been working with notify you within 14 days post-event if they have symptoms. That's really, really important. That helps your safety and the safety of everybody else. Staff welfare, as I've discussed before, your team are your major asset. So, staff breaks, opportunities for staff to leave rooms for fresh air, access to refreshments, bring own water bottles to reduce sharing of cups, advice to bring your own food to reduce going to other shops, cafes during the working day. That is to reduce the risk of transmission of the virus. If you're standing in a queue at Sainsbury's or wherever and you're waiting to get your sandwich, you just think that you're increasing those risks every time that you expose yourself, you're going to a different area. Think about the travel to and from the venue. Can they avoid public transport? At the moment it's quite quiet, but it is getting busier. Also, if you are bringing people down to stay, consider the accommodation options and don't assume that people are okay to share anymore, because obviously with things changing, so do talk to people in advance about any concerns they might have. And think about it's really important that you account for your staff within your risk assessment. So it's about your attendees and about your staff. First aid. So guidance has changed for first aid since COVID-19. Current advice is not to give mouth to mouth and to provide first aid from a distance or call 999 and support the individual until assistance arrives. If you have a first aid certificate, it may have expired because lots of people couldn't renew them last year. So you need to make sure that it is up to date, or any first aiders that are working in your event have a current first aid certificate. And again, back to cleaning, making sure that you're focusing on this within your own risk assessments. Think about your enhanced cleaning schedule. Create a tick list. What needs to be cleaned regularly or daily? Who's doing the cleaning? Is it contract cleaners? Is it your team? Use the right products for the job. Make sure your team know how to use the product and have appropriate PPE. Have sterilizer wipes and disposable cloths and cleaning spray on hand at all times to wipe down areas of concern. Now, over to you guys for some questions.
Hello. Should we go through some of the questions from the chat?
Yes, please. Yeah.
Lovely. Right, let me scroll up. There's quite a few. So first, Pete says, I'm doing a guided walk outside. What distance do people, brackets bubbles, need to keep apart?
So
this is a good one actually, because we've got quite a few walking tours taking place this year. So yeah, it's quite useful.
So when you're outside, ideally you want to have it whereby you are keeping the separate bubbles at least 1 meter apart. Or equally, you can request that they wear a face mask. But as I've said and reiterated many times, ventilation is the key thing. Being outside reduces the risk of transmission hugely. I think it's just about making sure that when you're talking and presenting to them, that you keep the distance from them, because actually they're going to be kind of talking to each other within that.
Great, thank you. Just to confirm, audiences in indoor venues must wear a face mask throughout the performance, ? Should venues have a box of face masks at the box office in case someone has forgotten theirs? Tickets have already been sold on the basis of 50% capacity, but is this actually going to be enough?
Okay, so let's just raise that question there. So yes, audience in indoor venues must wear a face mask throughout performance. Yes, currently legally, yes, that is correct.
Is it unless they're eating and drinking?
Unless, yeah. So if they are sat at a table, so if you aren't sitting in rows and you're sat at a table and you're eating and drinking at your table, you don't need to wear a face mask. But if you're not eating and drinking, you need to wear a face mask. So for instance, they haven't actually, we've been checking about the theatre guidance, and it does say that you need to wear a face mask, and it's the same with cinemas as well. So where you're effectively, obviously when you go to a restaurant, you're going there to eat. But when you're going to do something that isn't essentially going to eat or drink, i.e. watching a performance, you should be, yes, the rules are that you must wear a face mask. Tickets are already being sold on the basis of 50% capacity. It really depends on your venues. So I think that it's a question of assessing your venue and then having a look and working out what you can accommodate. But again, look at those other measures you can put in place. Can you increase the ventilation? If people are wearing face masks, you know, can you think about your 1 meter plus rule? You're not looking at separating up everyone by 2 meters. Can you clarify if 50% is based on total or normal seated capacity? Again, it's very venue dependent.
So Peter, my venue is outside and open to passers-by. Please, can you advise? Peter, do you want to ask the question in person? Because your event's quite unique, isn't it? In that you perform in the window of the shop and people stop and watch it if they want to, but it's kind of you wander past.
Hi.
Hello.
Yeah, basically I sing from my window on Middle Street.
Yeah.
And there's a pub opposite.
Yeah.
The Victorian pub. During the summer, sometimes it does get quite crowded. You can have maybe 100 people, give or take a few.
Yeah.
And I was just wondering what was the best way to kind of manage it.
So, the fact that they're outside, it's probably quite transient, isn't it? I mean, how long do you think people stay and watch you for? Not for, you know.
Yeah, people come and go.
Yeah.
Some people may stay for the whole duration, but a lot of people might just stay for 5 or 10 minutes.
Yeah. So it's about a lot of the measures are obviously looking at the build-up of aerosols over time and the proximity to other people who might be infected over time. I think for you, in a way, it's quite simple in that you're not sort of holding people there. You're not forcing them, you know, you're not saying you've got to be here for an hour. They're coming, they're transient. They can leave if they feel uncomfortable by the number of people around them.
Yeah.
So actually, the choice is more to them. So I think maybe perhaps the only thing is occasionally to say, if, you know, suitable and you really think that it's just like, oh, you know, don't forget, let's just respect everybody's space and things. So
Yeah. Yeah.
out there, but you're not, in essence, you're not really in control of that environment so much, so it shouldn't be too difficult.
I've got some stickers that say keep your distance.
Perfect.
Shall I put them on the floor?
I think so, yeah. I think that would be really helpful. So I think that, and if you have to write a risk assessment for the Fringe, I would just say, you know, your key things are that your audience are outside, you're putting the stickers out, and you will occasionally remind people to, you know, respect distance. So.
Okay, that's lovely. That's reassuring. Thank you. Yeah. Thanks very much.
Pete's got a question. How do you contact your attendees? I think this one might be more for me. Do you, in advance with any COVID instructions, is there a facility to email within the Fringe event setup website? We will, including people confirmation emails, will be kind of a Fringe Safely link to our Fringe Safely page. So people will be following kind of the basic advice. If there is specific instructions for your event, if you could email us at takepart@brightonfringe.org, and we can make sure that they're shared with the audiences before they arrive. Does that answer that question?
And I think, Amy, you know, you've got it on your website. The Fringe have been fantastic because they've done questionnaires. You know, they've looked at what really people care about. It's been really good engagement with their audience. And, you know, making sure that, so, and I think, you know, it's on the website, it's going to be reiterated through. So yeah, and as Amy says, you can just keep, you know, get that messaging out. So.
Should outdoor audiences wear face masks?
Currently, yes, I would say so, but it's not enforceable. It's not enforceable for anyone outdoors to wear a face mask. So it is a personal choice.
Kath, I think your question about post 21st of June was actually about something we were talking about at the time, wasn't it?
Yeah, it's just, as you know, so our our festival starts a little bit later. It's a bit cheeky to ask now, but just obviously some events also in Brighton Fringe start off 1st of June, and just giving some sort of gauge about what the change in regulations for then, I suppose.
Hang on, Kath, I'll just get my crystal ball.
Sorry.
Kath and I are very good friends. She knows this is my bugbear. I don't know. I mean, we're looking like it's going very positive, but I have to say that in terms of social distancing and guidance, a lot of the stuff I'm doing, a lot of the stuff I'm getting from the HSE is that they'll still recommend that things may change in the next month. I think the question is just to keep an eye on things and just to keep thinking about the 4 tests and see what happens there. So, but I think, you just got to keep thinking that no matter what happens on the 21st of June, and even if the government says yes, we're fine, COVID hasn't actually gone away. It doesn't just disappear. So you're still thinking about protecting yourself and your performers, and that's the key thing. So even if the audience are singing, dancing and everything about face masks on, you've still got a duty of care to the people you work with to look after them. And and obviously some people can't have the vaccine, some people choose not to have the vaccine, and so their risk is much higher, and you've got to account for that.
Cool.
From Brighton Fringe's side, if your event is after the 21st of June, we won't be selling tickets to it at its full capacity yet, and we aren't doing that until at least the 14th of June, because that's a conversation that we've had with the council, and we won't be putting all those tickets on sale yet, just in case. So that's the answer about capacities after 21st of June. What about drinking water in their seats?
Yes, then obviously they can remove their masks, drink the water, but the current legislation is they have to wear face masks indoors.
This is a good one actually. If you are doing a free outdoor event in a park or other public space, do you need to get contact details of all audience members?
So by free, I'm assuming it's unticketed. Is that correct? Is Sarah, you around?
Almost all events are ticketed for Fringe this year. We've asked for everyone to be ticketed.
So then if it's ticketed, you would still need to, and therefore then you're kind of managing the entry points. You will need to collect their contact details, yes.
Great. I think that's all the questions. Did anyone else have any questions that they haven't put in the chat and they wanted to ask?
Sorry,
Here?
on the same question, basically, we're doing an doing a paid outdoor show, but we're just aware that there'll be members of the public that may see the show or be part of it. Is there anything we need to do in terms of how, it'd be difficult to get their contact details or managing that? Is there any advice on that?
I think what you need to do is, where possible, is have your QR code up. It's about showing that you have tried, to make that, because to put those measures in place, and you're first and foremost, when you're writing your risk assessment and you're talking about yourself, think about how you're protecting. So if your show's outside, how are you protecting your team and your bubble? And then you're looking at the audience. Again, as I say, if it's a free show, etc. And equally, let's not forget that people are choosing to come to your event. They are putting themselves in that place. In theory, the way that the law works around health and safety is that your performers, even though I'm sure they've all come, with consent, you're kind of saying, right, we will be performing here at this time in this place. And so therefore, your priority is to put safety measures in for them. And then the people that are attending are kind of almost a secondary to that. So Sarah, for instance, if it's unticketed, it's essentially, if you're managing the control areas in and out, then you definitely need to collect their details. If it's a more free-flowing thing and people are kind of walking by, then you don't need to collect their details. Does that help?
Yeah, no, that's great.
Yeah.
Thank you. Yeah.
Right. Look, if anyone has questions, we're going to do some handouts and things anyway, but equally, I'll make sure we put our email in and things. So if you just have any thoughts, things are going to keep changing. But as I haven't got a crystal ball, but we will try to help if they've got a few questions. We're going to be, because we want you all to feel confident as well. I'm so excited about coming out and seeing people's shows and getting outside. and I know lots and lots of people are, but you know, we want to make sure that we're really keen to show that we've done everything we can and the due diligence and stuff to make sure that we're safe. So yeah, if you need anything, you can always drop us a line and ask us a question. So
I just have a question concerning cleaning.
yes.
We have a certain amount of wooden crates and other props like hats and things, some of which I'm not entirely sure how we clean them, because obviously there's some which are like plastic and things we can wipe down, but what do you recommend for wooden crates? Because I'm not really sure if regular wipes would work or not.
Yeah, so are the props just being used between yourselves, with the performers? They're not being touched by the public?
No, they're being handled just by the cast and possibly the team, so me and our director, basically. There's not a lot of us.
Yeah, so all I would do, I would probably at the start of the run is I would just spray them. You can get quite a good like microbacterial spray, and then you can just spray them, and then, you know, I don't know how long your run is for, but you know, if it's more than a few shows, possibly just do that once a week and just let it kind of dry off.
Do you know if that would interfere with fireproofing, because we have to make sure they're fire safe as well?
No, it shouldn't, unless you're spraying with a very high alcohol content, so avoid that. There's a good product, I'll try and remember the good product and put it in the chat. Actually, Christina, we'll find a couple of good products and we can put them in for you that will not be, yeah. So basically high alcohol is obviously flammable, so try to avoid that.
Okay. Thanks.
That's another thing as well, by the way, just to let you know that hand sanitizer can be flammable, so just make sure it's dried in before you have a cigarette.
On hand sanitizer, we as Brighton Fringe have got a huge stack of hand sanitizer and antibac that we are distributing to all venues as well, so they'll all have a stash. I'm sure they'll have their own, and I'm sure people will bring their own, but we have provided that, and you can maybe ask your venues about getting access to that stash as well, so it doesn't cost you any extra money, because we've done some of that.
That's great, Amy, that's fantastic.
Can I ask you a question that I get asked all the time on email?
Yeah.
So people always ask me, if my venue are doing a risk assessment, why do I need to do one too?
Okay, that's a really good question. So your venue's risk assessment is very specific to their activities, and your risk assessment should be specific to your activities. As a performer, you know, you're coming in, you're looking at, even if you're making, we're not talking, you don't have to write 10 pages, you're just doing your top, you know, the top key things that you're doing to protect yourself and your colleagues. And then also, you know, the measures that you're putting in place to protect the audience. So for instance, if you are a performer that is normally very interactive and jumps on people's laps, we're not really doing that at the moment. So, you know, but those are the things you're highlighting out. It protects you, it protects the venue, it protects attendees, it protects the Fringe. And it's all just about that kind of duty of care for everybody.
Thank you. I've got one more. This is another one I get all the time. This is usually from people who are doing stand-up shows, and it's just one of them. If it's just me and I don't employ anyone, why do I have to do a risk assessment? Well,
technically, by law, you don't have to write it down, but if the Fringe has asked you to do one, then you have to do one.
I'll try telling people that.
It's one of those things as well, isn't it? A venue may ask to see your risk assessment. You know now, because everyone's conscious and aware of it. It's, as I say, it doesn't have to be onerous. I've got a template that we're going to send out. Amy can send out to you all that you can fill in, and it will just show, you know, think about those key things. And if it's just literally like, I clean my microphone after I bring my own microphone, so I don't have to share with other people. I wash my hands when I come in. I'm not going to spit on the front row of the audience. There you go.
Great. Thank you. Cool.
Okay.
Peter, have you got your hand up?
Actually, just touched on that. There's just two of us in the show. You've talked about the 2 metre rule. We're in quite a largish room, but we're told the sound is pretty good, the sound use of sound. So we're not using microphones. So do you recommend a greater distance between performers and first row? That's the question.
I think at least, yeah, it's got to be 2 meters. Because if you're
Okay.
you're projecting to the back.
Oh yes,
you're
but not more than that. More than that.
No,
No.
2 meters is generally, it should be fine. And
Okay.
and also just check obviously the room's ventilation and things like that. So
Yeah, it's a big room.
Yeah.
We're down to a 25% capacity.
Oh right, okay.
Lovely.
Great. Well, look, if anyone thinks of anything else, obviously ask Amy. As I say, we're going to have some handouts to send out. And then, yeah, and I really look forward to seeing all your shows, and I hope they all go well. And, yeah,
Thank you.
Thank you.
Thank you.
Thank you so much, Becky. Cheers. Bye.